Yesterday we have seen up to all the signs and symptoms. Okay. Now we will see the diagnosis. What is there in the diagnosis? Which type of diagnosis we will take? Means doctor will take. First, the doctor will ask the history. Mainly that is the history. Because if we don't know the history, then we can't treat nicely, exactly to that individual. Isn't it? History is important. So what they will, what the type of history they will take, what the type of history the doctor will take, that is the family history. First, they will ask the family history. If anyone in our family is having any hypertension, they will ask here. That is the family history. Okay. And second one, in that history, they will ask to that individual. That individual is either suffering from the other cardiac diseases like the CAD, coronary artery diseases, or heart failure, or other having the coexisting disorders like the stroke, renal dysfunction, means any type of the kidney damage. So if the patient is suffering from the diabetes or having the high lipid proforma, or that individual is suffering either this gout, all the history they will ask to that patient. Okay, that individual. This is one type of the history. Okay, family history and the individual's history. Family history, if the patient's parents having the history of the hypertension, the doctor will ask. And the own history of the individual, whether that individual is suffering from any cardiac diseases or any other these kidney diseases or other diabetes or some gout or having the high lipid proforma, the doctor will ask. And next one, that is the social history. Social history, in that social history, the doctor will ask the exercise level. Sometimes what happen, if we will exercise more, due to the more exercise, the BP will increases. So the doctor will ask about the exercise level. And other thing, that is the if the individual is habitual of tobacco smoking or tobacco chewing, alcohol, or the other stimulant drugs. Stimulant drugs, some of the individuals are habitual with the of taking the abused drugs. Okay. So the doctor will ask the social history, means what? It includes the exercise level, tobacco chewing, alcohol, then other having the habitual of the stimulant drug, that is the abused drug. And next one, the dietary history. Dietary history, whether the patient, whether the individual is habitual with the high intake of the salt. Due to the salt increases the BP. And the stimulants like the tea, coffee, caffeine containing sodas, energy drinks. This is all about the history. Okay. Now next one, in the diagnosis, physical examination. Physical examination means what? This is all about the history. Okay, before that one. Then after that one, the doctor will check the BP on the BP apparatus. And also according to the height, body weight, that is the body mass index, the doctor can understand the whether the patient is having hypertension or not by measurement of the BP on the BP apparatus. And then due to that, all the history and physical examination, they will ask to do the testing. In that testing, blood urine test, ECG, electrocardiogram, chest X-ray, ophthalmoscopy, and these always, if it is more, then keep the doctor to that patient on the BP monitoring daily or once in a day or 2 times a day. That is the BP checking. Okay. So what are these testing? To confirm that one, to confirm the individual is having hypertension. How, which type of that one? So they will tell, the doctor will tell to do that test. Medical and family history we did. Okay. Then blood and urine test. Okay. Electrocardiogram, chest X-ray, ophthalmoscopy is also necessary. Okay, due to this in the diabetic patient, some of these are having that problems of the eye. So ophthalmoscopy is one of the test, and then the BP monitoring. Okay. Sometimes what happen? The target organ, that is the due to the dysfunctioning of the kidney, and the other cardiac symptoms are there, like the stroke, CAD, coronary artery diseases, heart failure, isn't it? These are the coexisting disorders. So the direct target organ damage, due to that also the patient, the individual is suffering from the hypertension. Okay. Identify the cardiovascular risk factors. Same. Okay. So these are the diagnosis. Which are we seen? Diagnosis, how to take the diagnosis? History first they will ask, then physical examination, and the various textings are there, like the medical and this family history, the doctor will take, blood and urine test, ECG, chest X-ray, ophthalmoscopy, BP monitoring. Then we will see, go through the treatment. Okay, go through this treatment. Treatments, the patient is having what? Hypertension. So what we will give? Anti-hypertensive drugs. What we will give? Anti-hypertensive drug. So what happen? They will decreases the cardiac output and peripheral resistance, or both, and due to that the patient, that BP will decreases. So many classes are there. Okay, so many classes are there. We will see next in that this one, drug therapy. Okay, in that drug therapy all the drugs we will see. Here only I mentioned this one, but we will see later. Okay, that is the first one, antihypertensive drug we will see. Okay, then next one, the lifestyle modification. What is there in the lifestyle modification? If the patient is due to the higher weight, there is a BP, then lifestyle should be changed, no? So weight reduction. Okay, in obese patient, if the patient is habitual with the high intake of this sodium, then the patient should be, the individual should be low the sodium intake. Okay, so these are the life modification. Increases in this exercise. Okay, decrease the alcohol intake, decrease the sodium intake, so otherwise decrease the salt intake, and increase in the exercise, where in the weight reduction in the obese individual. Okay, next one, the drug therapy. We will going to see this one, drug therapy. Which type of drug therapy we included here in the hypertension? Diuretics. Why diuretics? Because one of the cause of the hypertension is high volume of the high volume. Due to that high volume, there is a increase in the BP. So diuretics, what happen? It promotes the urine output and it reduces the volume of the blood. It reduces the volume of the blood. So due to that high volume, there is an increase in the BP, there is a hypertension. If we will give diuretics, then it promotes the urine output, it increases the excretion of the urine, and due to that, it lowers the blood volume, that is the diuretics. Examples, one or two examples you have to keep in your mind. Next year in the pharmacology, you have all these one. Okay, in detail, there you will write. Okay, here now I given here in detail, but how much possible, that much you can keep in your mind. Okay, thoroughly I have given here, But how much possible, that one only you have to keep in your mind. Simple one, simple things. Diuretics, then beta blockers, propranolol. Okay, calcium channel blocker. Due to the calcium intake, high calcium intake, there is an increase in the BP. So calcium channel blockers are there, verapamil, nifedipine. Angiotensin converting enzyme inhibitors. Yesterday we have seen that one, isn't it? All the schematic representation. So angiotensin converting enzyme inhibitors. Inhibitors we will give so that the BP will decreases. Cetoprolol, enalapril. These are the examples. Angiotensin second receptor blockers. Okay. Alpha 1 adrenergic blockers. Don't remember all these one if you are not able to remember. Keep one only, the urine diuretics. This one direct vasodilators. Isn't it? The simple you learn. Okay. Central cardiac adrenergic inhibitors. Okay, the angiotensin converting enzyme inhibitors. Simple you keep in your mind. Okay, don't fully remember all this one, that is hectic, but I have given here, just go through this one, so that what happen when you will come to next year, that is you have to learn their pharmacology, then it is easy for you, because already you read that one, this is sufficient. Okay, now prevention and control. How you will prevent and control the hypertension? You know the causes of the BP, isn't it? You know the causes of the BP. Then what are the causes? You know the causes, then you prevent that one. If you know that due to the obesity, there is increase in the BP. So reduce your weight and keep normal. Okay. If you know the due to the intake of the salt in the diet, then you reduce the intake. If you know the we are alcoholic, then so that's why the BP is increased, then reduce that one. So we will see here, check the BP regularly and keep it under control. We have to check the BP. We have to check the BP regularly. Okay. Avoid the stress. Stress is the, for every diseases, this is the stress is the main cause, isn't it? Due to that stress, we will prone to diseases. So avoid stress, isn't it? One thing I will use to tell you, my students, that is, happiness never come automatically, isn't it? Negativity will come automatically, but positivity is our choice. We have to choose that one, isn't it? Negativity, everyone will give negativity, everyone will give sadness, isn't it? But happiness is our choice. If that you have to select, that we have to select, isn't it? So avoid any type of the stress that are uncertain, that are uncertain. See here now, the corona came uncertain, isn't it? So we lock down. That is uncertainty, isn't it? That is not in our hand. But what is in our hand? Every time, in every situation, we should be positive, we should be happy, we should be stress free, or otherwise what happen, all the diseases due to our mental, that is the mansik swasthya, isn't it? So that is the, it is totally, it is a mentality, due to our mentality. Okay, so how much possible, that much we should avoid the stress. now avoid the smoking, tobacco chewing. We know tobacco chewing or smoke, due to that smoking, the BP increases. So avoid that one. Regularly check up of the sugar, because due to the diabetes there is a hypertension. So check your sugar level. Restrict the high intake of the cholesterol and triglyceride levels in the diet. Due to the high fatty intake, there is a increase in the BP. So avoid that one. Restrict the high intake of cholesterol and triglyceride level in the diet. Maintain the healthy weight. So what we have to do? Daily exercise, at least for half an hour. At least for half an hour. if it is possible for you, then at least 2 hours you have to give yourself. In that exercise, daily exercise, yoga and pranayam, everything that should be included. So we will be healthy weight, healthy mind, and our healthy body we will keep. Healthy mind, how we will get? Due to that meditation, isn't it? So eat a balanced diet. How we have to eat? Balanced diet, exercise regularly, limit the alcohol intake, eat the lots of fruits and vegetables. Which vegetables? Green vegetables. Okay, lots of fruit and green vegetables. These are because of these sophistications, we can prevent the hypertension or we can control the BP, isn't it? So these are the prevention and control of the BP. Now, what are the complications are there? Complications means what? When the complications will take place, if we will not if we will not treat the BP, if we will not treat the BP, then what happen? It will progress. It will exaggerate, isn't it? And then the secondary infection, the secondary diseases will take place. Then sometimes what happens? The other organs will damage, isn't it? Due to that BP, which may be possibility is there. There are the chances to get the coronary artery disease, that is the CAD, coronary artery disease or myocardial infarction, MI, means myocardial infarction, heart attack. Heart failure, there may be chances of heart failure due to that hypertension. Stroke, stroke is there, that is the hemorrhagic. Sometimes kidney failure is there, renal failure is there, and last at the end, death is there. So if in the first stage only we have to treat the disease, or otherwise there may be chances of complications. In the complication, that is the disease will go into the second stage, third stage, fourth stage, and at last it is the death, isn't it? Are you understand this one all? Then we will see the summary, then you will understand this one. Is it visible, my screen? Visible?
No, ma'am.
Huh?
No, ma'am. No,
No?
ma'am.
Okay, wait. Again, I will share, okay? Now you tell me. Is it visible now?
Yes, ma'am.
Okay.
Yes, ma'am.
Okay. Now see, what we seen in the hypertension, we will memorize. These are the memory points. Don't read thoroughly. Okay. First, only we read thoroughly. We understood these diseases properly. Now, how to remember? That is the memory point, isn't it? Now, hypertension means what? High blood pressure. Okay, it is defined as abnormally high blood pressure in the arteries. How much normal blood pressure? It is 120/80 mmHg. 120/80 mmHg. If its level is increases, then we call it as a hypertension. Now, what we seen yesterday? What we seen yesterday? That is the types of the hypertension. How many types are there? 7 types are there. Primary hypertension, secondary hypertension, benign hypertension, malignant hypertension, isolated systolic hypertension, resistant hypertension, and hypertension during pregnancy. Okay, if you know all these are the highlighters. Okay, now, what do you mean by primary? There is no any cause we know, that is uncertain. Most of the time, the why the BP is increasing, that we don't know. That is the cause is unknown. So we call it as a primary hypertension. 90 to 95% people, they are having the primary hypertension. Now, secondary hypertension means what? The cause is, we know the cause due to some reason. That is the some due to some heart problem, due to some other diseases like kidney diseases and other diseases, diabetes, gout. Due to the here in the secondary hypertension, we know the cause. That is the secondary hypertension. Okay. Now, what is there in the benign hypertension? Moderate increase in the BP is there, and throughout the year, slowly increase in the BP is there. But what is there in the malignant hypertension? Rapid hypertension is there, rapid increase in the BP is there, and throughout the year, it is increases tremendously. That is the malignant hypertension. And what is there in the isolated systolic hypertension? The name itself indicates. Systolic means what? It here only the systolic BP increases. It doesn't increases the diastolic BP. The diastolic BP remains same as it is, that is the 90 or below than 90. Okay, but only the systolic BP increases. That is sometimes 150 to 160. Normally it is how much? 120 mmHg. But here in the systolic hypertension, the BP goes. Which one? Which BP increases here? Only the systolic BP. Sometimes it increases 160 above the 160. So that's why we call it as isolated systolic hypertension or isolated systolic BP. Okay. Resistant hypertension means what? Though we are taking the drugs, though we are on the drug treatment, sometimes what happens? Combinations are there. In the hypertension, one drug regimen is not there. Sometimes two drug regimen, three drug regimens at a time is there. Combinations we are taking. Then also the BP is in a increased state only. They register for that drugs. There is no any chances to decrease the BP. That is called as a resistant hypertension. That is called as a resistant hypertension. Resist to the drug. Though we are on 3 drug regimen, then also the BP will not lower. So we call it as a resistant hypertension. And hypertension during pregnancy, during the first pregnancy, there are more chances. Some of the patient, not all the patients, okay, not all the ladies, but first pregnancy or due to the hormonal changes, there are chances of hypertension during pregnancy. These are the types of the hypertension. Are you got all these one? Primary, secondary, benign hypertension, malignant hypertension, isolated systolic hypertension, resistant hypertension, hypertension during pregnancy. Okay. Now we will see the etiology. What are the causes of that hypertension? Genetics, family history, from the genes transfer from parents to the offspring. That is the genetics. Racial, blacks or white, isn't it? Environmental factors are there. So many environmental factors are there, isn't it? Age and sex according to age, and as the age increases, there are the chances of what? High BP, isn't it? Smoking, habitual of smoking, alcoholic, high weight, alcohol intake, salt consumption, geographic variations. Autonomic nervous system means what? Here the sympathomimetic means what? Sympathetic nervous system. Here the main role of this one. If we run fast, if we talk fast, if we anger tremendously, then there are the chances of increase in the sympathetic nervous system, isn't it? The activity of the sympathetic nervous system increases. These are the autonomic nervous system. Renin, angiotensin, aldosterone system. We learned systematic representation systematically yesterday, thoroughly. That is the Renin, angiotensin, if the blood volume is decreases, that gives the signal to the kidney to secrete the renin, and then all the terms and conditions there are there. There is what angiotensinogen secretes, and that converts the angiotensin to angiotensin first to second, isn't it? Then secretes the aldosterone, and that because of that aldosterone increases the volume of the blood, and due to that it controls, it normalizes the BP. Okay, endothelial dysfunction, hormonal dysfunction. Okay, certain medication, due to that some certain drugs or medication, there are the chances of hypertension or BP. Okay, like the what we some other certain medications are there, isn't it? Okay, we will see that one. Certain medications, pregnancy, if I have to avoid that one, contraceptive, because of more of the most of the ladies takes the contraception drugs. Due to that also the BP will increase, isn't it? The other causes, most of the cause, that is the stress is there, family history of the blood pressure, chronic kidney diseases, adrenal or thyroid disorders are there. Sometimes diabetes is also there. Okay. Then signs and symptoms, simple breathlessness, severe headache, bleeding from the nose, that is called as epistaxis, isn't it? Fatigue, sleepiness, confusion, ringing in the ear, that is the tinnitus, nausea vomiting sensations are there, profuse sweating is there, blurred vision is there, chest pain is there, difficulty in breathing is there, that is only the breathlessness, isn't it? So hypertension is usually asymptomatic, but un- when it goes to the secondary, the complications will develop to the target organ, that is the secondary. Other are flushed faces are there, headache is there, fatigue is there, epistaxis. In the severe type of marked elevation of the blood pressure, they develop the dizziness, means giddiness. We can call it as a chakkar and dizziness or giddiness, flushed faces. That is the in that the profused sweating is there, headache, fatigue, epistaxis, blood coming from the nose, nervousness is there. Okay. In the severe hypertension, we will see cardiovascular, neurologic, other the organs will damage, isn't it? And other the disease will take place. Sometimes the heart failure is there, atherosclerosis there, the hardening of the blood vessel. Sometimes kidney failure is there, isn't it? These are the signs and symptoms. And diagnosis, in that diagnosis, what the doctor will diagnose. Before that one, they will take the history, that is a compulsory, or otherwise doctor will not understand this one, why the hypertension is there. So always there is a history is important, always they used to take the history. Due to that history, the doctor come to know whether it is family history or that individual history is there. Family's history is also important, and that particular individual history is also important. Then social history, tobacco chewing is there, or some other things are drug abusing is there, other things are. Dietary history, lipid profile is there. If they are, the individual is eating some more lipid food or cholesterol food, triglycerides containing food, that is the dietary history. Okay. So many histories the doctor will take: individual history, family history, social history, dietary history. Okay, then physical examination, BP monitoring. Okay, test, urine analysis, blood test, urine test, ECG, checks, X-ray, everything they will suggest. Okay, and the treatment. What is the treatment then? Antihypertensive drugs and lifestyle modification. This is the our choice. We have to the lifestyle modification. Okay, regular exercise, diet is good. Everything should be good. Okay. Screen गेली का रे?
Oh, ma'am.
Okay. Our meeting will end just now. We will see. Now it is okay. Is it visible?
Yes, ma'am.
Yes, ma'am.
Okay. Drug therapy now. See, diuretics are there. Beta only one or two or three you have to remember. If it is easy for you, then you remember only 2-3 drugs. Okay. Diuretics, beta blockers, calcium channel blockers. Okay. Direct vasodilators are there. Okay. This much is sufficient in this level. Okay. But I given here to just read this one. Okay. And prevention and control. How do you have to prevent? Check the BP regularly, keep it under control, reduce the intake of the salt diet, avoid the stress, avoid smoking, avoid tobacco chewing, avoid alcoholics, restrict the high intake of cholesterol, triglycerides, maintain the healthy level, eat a balanced diet, exercise regularly, limit the alcohol intake, eat a lot of fruits and vegetables. Okay, these are the prevention and control. If we know the causes, then opposite to that, we have to avoid that one. That is the prevention, and according to that, we can control our hypertension or BP. Complications, secondary stage. Okay, that is if we not treat properly, then obviously it goes to the second level. That is the some of that one will prone to coronary heart diseases or coronary artery disease or myocardial infarction, heart attack, heart failure, stroke is there. Okay, hemorrhagic, that is sometimes immediately the hemorrhagic, the sometime what happen, in the brain, the hemorrhage will happen. Okay, so that is the stroke. Renal failure is there, kidney failure or death. These are the complications are there. This, so we cover this hypertension, and tomorrow Sunday it is off. Monday we will run. Okay, I will stop here only. Everything is. Can you understand all this?
Yes, ma'am.
Okay.
Yes, ma'am.
Okay. So, are you with your notebook and pen? If not,
Yes, ma'am.
Yes, ma'am.
if not, you habitual with all these things. Okay. Okay. So we will end here only our meeting.
Okay.
If you have any problems, you ask me in the our group. Okay.
Yes, ma'am.